Welcome. I'm Dr. Mache Seibel, and you are at Ask Dr. Mache, and this is Facebook Live. And welcome. Tonight, we are going to talk about estrogen alternatives. Menopause 101, alternatives to estrogen. And I think this is going to be very important because last week, you may recall, I had questions about alternatives to estrogen, and at that time, we were focusing on other things. It was a whole discussion, and so I thought, what better thing to do than come back, let's acknowledge what you wanted, and let us talk about alternatives to estrogen. I want to ask you to like the page, because then you'll get access to when I'm going to do Facebook Live at random times that I do when something comes out or something new happens or something I want to share with you at that moment, and you'll know about it. And also, I want to tell you that we're here every week, 9 o'clock p.m. Eastern, 6 o'clock p.m. Pacific, and we have a topic focus, but if we don't have questions on that, or sometimes we'll slip into other questions as well. So I want to begin this discussion with you on alternatives to estrogen with a basic philosophy, because I think this is really important to understand. When you take estrogen as your choice for menopause symptoms, there's something that's unique to estrogen, and that is estrogen goes to just about every cell in your body. And the benefit of that is, if you're having hot flashes, it goes to the hot flashes. If you're having brain fog, it goes to your brain. If you're having trouble sleeping, it works on sleep. If you're having difficulty with a sensitive bladder or vaginal dryness or other symptoms, it seems to accomplish most of the symptoms of menopause. It seems to accomplish treating those symptoms. But here's what happens when you choose alternatives to estrogen. So be mindful of this. When you choose alternatives to estrogen, you're really treating a specific symptom. So if it's hot flashes, you'll be addressing hot flashes by and large. If it's a problem you worry about thinning of your bones, you're going to treat thinning of the bones. If you're going to be worrying about sensitive bladder, you'll treat that. Brain fog, you treat that. Sleep, you treat that. It's all separate. And so it's essential that you keep in mind that you have to take care of the sum of you and not just some of you. Because otherwise, you have to recall that while you may be having a symptom like hot flashes that's driving you crazy, at the same time, there may be silent things going on, like hardening of the arteries, or thinning of the bones, or changes in the vaginal tissues, or bladder tissues, and so forth and so on. And so you've got to be proactive about those parts of you that are silent and are not making any noise. So as a consequence, you may get lulled into treating the thing that's talking the loudest to you, often hot flashes, but it may not be addressing those things that are smoldering along beneath the surface. And I want to make you just mindful of that. It's so important when you choose alternatives. Now, there are a couple of general things that I want to talk about with you when it comes to alternatives that I think are very important. The first thing is, I think it's important to just do one thing at a time. If you take one supplement or you try one approach, you've got to give it time. It's not usually as immediate an impact as hormones might be. And so as a result of that, it may take 2 to 3 months for you to notice a difference. So, first of all, do one thing at a time. And then number 2 is give it time. And by that I'm saying 2 to 3 months. And then, if it doesn't work to your satisfaction, don't add to it. Take it away and add the next one. Because if you mix and match these things, what happens is you'll never know if it's the combination of things or it's one thing or the other thing. And as a result of that, you won't know what's working. And so those basic things I think are very important. And be prepared to try 1, 2, 3 or more things. And then if you go through a whole slew of them and they're not working, then it might be necessary to try them together. Now, when it comes to approaches that are alternatives to estrogen, they basically break down into 4 compartments. Number 1 is non-estrogen or non-hormonal prescription medication. So there are some, and we can talk about those. So there are some prescriptions that have come out for very specific things that are available only from your doctor, but they are not hormones. And there's one that's even a combination hormone, non-hormone. We can talk about that as well. The second category of treatments is behavioral in mind-body. And there are some very effective things out there that you should know about. And we can talk about those as well. The third category has to do with lifestyle changes. Don't underestimate the power of what you can do if you simply alter your lifestyle. And I'll expand on that in a little while, depending on the questions. And then finally, number 4, there's nutrition and supplements. So these are the 4 categories. Over-the-counter products, not necessarily only supplements, but over-the-counter products. So we've got those 4 categories. So number 1 is realize, take care of the sum of you and not just some of you, both the things that are affecting you immediately and the things that are silently happening beneath the surface. Number 2, realize that there are several categories of these treatments. And number 3 is realize, do one at a time and don't mix and match, and give them 3 months each and then drop it and move to the next one. Now, if there's any questions about that, let me ask you to go ahead and start to ask them, and then we'll use that as a springboard, and I'll fill in some of the gaps as we move forward. Anything you'd like to ask about at this time? Well, let's talk about some of the prescription non-hormones that are available. Turns out that for one of the symptoms, hot flashes, which is one of the most worrisome symptoms for many women, there is a medication available called Brisdale, B-R-I-S-D-E-L-L-E, Brisdale. Its actual name is paroxetine, and it's 7.5 milligrams of a medicine, paroxetine, that has been used as an antidepressant. But it turns out that paroxetine can be very effective for hot flashes, and it's not a hormone. And even though it's an antidepressant, the dose that they have it at, in which it was approved by the FDA for treatment of hot flashes, is actually too low to affect your depression. So if you are struggling with depression and you are looking for a medication for it, this is not the right medicine for you. You need a stronger dose in order to treat depression. But if you have not depression, but if you have the hot flashes, it's very good. Now, one of the side effects are it can make you sleepy, and if it makes you sleepy, that's a good thing, because sleep is another big issue. I see Katie there. Welcome, Katie. Why not just use 10 milligrams? Well, that's logical. If 7.5 isn't enough, let's go with a higher dose. But to do that, you wouldn't be using Brisdale, which was approved by the Food and Drug Administration at a specific dose. When you do clinical trials, you've got to pick your dosages, look for the risks and the benefits, and that's what you do. So if you wanted to work with your healthcare provider and try a higher dose for depression and hopefully hot flashes, you can do that. There are also SNRIs, not SSRIs, but SNRIs that are available like venlafaxine and some other medications that are also used for hot flashes, and those can be effective. But as a FDA-approved medication, the Brisdell is the only one out there that's FDA approved. So it's a good question, but that's why you can't get an approved one where you know what to expect. Hi, Rose. Welcome here. I want to, sorry, Calcion, I'm not sure what that is. Not sure what that is. Maybe it has another name I'll recognize it by. Diane comes in. Why am I so itchy? Well, itchy skin, dryness is something that can happen as a result of menopause. And as you know, people get vaginal dryness. They also can get dry eyes. That's not an uncommon side effect of menopause. And they can get dry skin. Now, some people get these senses that there are things crawling on them and other kinds of weird sensations that come along with it. It's not really itching, but those are symptoms of menopause. But the itchiness generally comes from the dryness that's associated with menopause, and that's usually as a result of lower estrogen. So that's probably the most common reason. But in the meantime, you can certainly do things like use skin lotions and so forth to moisturize your skin. But it can be, of course, other things that cause itching. So if it's a persistent itch, then I would certainly talk with my healthcare provider and see if you can get some assistance with that, because certainly itching is maddening. Traina, hi, how are you? How long does menopause last? That's one of the most common questions, and it's confusing because it can last different amounts. The average person was going to have symptoms for about 3 to 5 years, but menopause symptoms can last up to 10 years, and sometimes for about 7% of women it can last even longer. They're most intense, though, the 2 or 3 years before menopause, which is the final menstrual period, and post-menopause about 2 to 3 years. So that's the window of most intensity. Hi, Rosa. How are you this evening? How long do hot flashes last? Once again, as I was saying before to Traina, hot flashes can last a long time. And for some women, it can be only a few years, same as the symptoms. And for some subset of women, it can be 10 years or more. For about 7 to 8% of women, it can last beyond 10 years, which is a lot. You are very welcome. I'm very happy to help. I'm here to help you. And for those of you who don't know my story and what got me started in this, I was one of the top infertility doctors in the country and actually did one of the first in vitro fertilizations in the United States. And then when that study came out in 2002 about estrogen causing breast cancer, which was actually incorrect, and I've talked about that a number of times and will continue to talk about it, and it's really the thrust of my book, The Estrogen Window. Here I explain about estrogen and estrogen alternatives and that the timing of when you take them impacts everything. But my wife was thrown into early menopause by surgery only about 7 months after that incorrect study came out, and none of her doctors wanted to give her hormones. So I shifted to focus on menopause and to help women understand the safety, how to do it, and how to help them thrive in this very transitional window of life. Hi, Lisa. She says, I've been on hormone replacement therapy for about a year now. How long will I need to do this? Well, hormone therapy is one of those things that you can be on for a very long time. Actually, 10 years, maybe 15 years, maybe longer on an individual basis. But everyone agrees that if it started in the estrogen window, close to the time of menopause, then you can stay on it for 5 and certainly for most people up to 10 years. And it depends. There's a lot of subtlety. It depends on if you have medical risks. It depends on if you are taking estrogen by itself or combined with progesterone, etc. There's a lot of nuance to it. So I would say think of it as a 5-year renewable option. Almost everyone can stay on it. Who can start it can stay on it for at least 5 years, most for 10, and some for much longer. Katie, welcome here. Super cool you do these talks. Well, thank you very much for saying so. I'm very grateful to you for showing up and giving your time, and I am here to make sure that you get the information that you need. I know that the average doctor's visit is only 8 minutes long. It's not enough time to really get the kind of information you need, and then a lot of times you kind of finally get your courage up to ask a question just as the office visit ends. So I'm here. I'm dedicated to helping women around the world to get the information they need to live healthy, happy, and vibrant lives. And so tell your friends, like the page so that you get notices as we do these along the way at different times. Amanda, hi, how are you? Hello to you. How can I help you? Well, some of the other things I want to mention to you about with the hot flashes are, we talked about lifestyle, and so let me talk about what I mean by lifestyle. Lifestyle includes, in my mind, 4 important pillars that you need to really focus on to live a healthy and happy and optimal life, whether you need to take hormones or not. There's 4 things you need to work on. Lowering your stress. You need to work on increasing your sleep. How many of you have had some, pretty crummy sleep nights? I bet a lot. And then there's got to be time for exercise. It's just terrible how sedentary we all are. We drive to work, we sit at our computers, we watch TV, we answer our emails, all this stuff. We're sitting on our big old behinds, and they're getting bigger because we're not actively exercising. I mean, I make time every week. I walk almost every day. I do have a personal trainer I go to twice a week. And this is part of my fabric, and you should try to do whatever you can to make exercise part of your life. And the 4th part is nutrition. So lower stress, get more sleep, exercise, and nutrition. Those things are going to help you whether you're taking hormones or not taking hormones. And the thing is that in order to take care of the sum of you, you've got to address all of those things, because it's like having a car with 3 great tires and 1 flat. When you're driving your car with 1 flat tire, it's not going forward nearly as well. And if you just do a little bit to improve each of these, it will help you move forward in your life towards better health and optimizing the quality of your life. Rose is asking, is insomnia a symptom of menopause? Oh, yes. Many of you may not remember the Marx Brothers, but one of Groucho said, I've got insomnia and I'm trying to sleep it off. Well, insomnia is a very big issue, and it happens for a lot of reasons if you think about it. I mean, you go to sleep, and some of it may be you're stressed. Maybe menopause has caused some sadness or depression. There's a lot of reasons that people have trouble sleeping, but relative to menopause, you may be having a sensitive bladder and have to get up and go to the bathroom. You may be having hot flashes, that are just going off at night, waking you up. How can you sleep? And you might have issues related to estrogen being lower, because estrogen affects the brain waves, the stages of sleep that are optimized, the REM sleep, rapid eye movement sleep. It lowers the amount of rapid eye movement sleep, and people don't sleep as well. So yes, insomnia is a big part, and something that there are things that you can do something about. Diana says, my sleep is interrupted every 2 hours. Yes, that's terrible. It's miserable, and it's common, unfortunately. And if you have that problem, you've really got to focus on things that can help you. Now, we're talking here today about non-estrogen treatments. Hormones will help that most likely, but as non-estrogen treatments, you can look into mindfulness and what's called CBT, or cognitive behavioral therapy, and there are some very effective things that you can do in your mind that can help you sleep. Also, if you're having hot flashes, you can get lower the temperature in your room can help, and then there's lots of little sleep hygiene things you can do, like in addition to keeping the temperature lower, relax in the last few hours before bed, stay away from the late night news because it's so distressful and upsetting, and listen to peaceful music. Getting away from the computer at least 2 hours before bedtime. Exercise during the day, but not within 2 to 3 hours of bedtime, can help you feel more rested. There's a lot of things that you can do. And if you want to see how much menopause is affecting you and the symptoms of menopause, I have at the top where the URL up here where we list the title, but you can go to menopausequiz.com and take the menopause quiz. It's free, it's 2 minutes long, and you'll get some instant feedback. menopausequiz.com, and you'll get the top 6 symptoms of menopause, and you'll see how much those symptoms are impacting your life. Laura says sleep is optional. Oh, my dear, no, no, no. Sleep isn't optional. I will tell you something. People who don't sleep well have increased weight, increased heart disease, increased high blood pressure, increased risk of diabetes. It's not optional. When the leaves fall off the tree, it's not like nothing is happening. That's the restorative time when the tree's getting ready for those beautiful, the leaves that come out and the buds and the flowers. So rethink that belief, because I think you may find, you're saying that your room is 62 and you still can't sleep. Well, you know what? Cool temperature helps you sleep, but it doesn't guarantee that you sleep, because it's only one component of it. But there are many things that you can do. Hi, Katie. Is the estrogen in soy safe if you can't take hormonal estrogen? I don't know why you can't take hormonal estrogen, but let me just say that because of the magazine that I edit, it's called the Hot Years magazine, Hot Years magazine. And as a matter of fact, if you go to hotyearsmag.com, hotyearsmag.com, you can get a free subscription. I do that for everyone that comes on my Facebook Live. I've interviewed a number of soy experts. There's Ken Sechel, who's at Cincinnati, and Mark Messina. These are some of the world's top people. And it seems that even for breast cancer survivors, that soy is safe. And it's best, if you're going to not eat the soy foods, if you're taking supplements, to try and go with the genistein, G-E-N-I-S-T-E-I-N, genistein, usually about 50 milligrams a day, up to perhaps 100 milligrams a day. And that can be very helpful for the hot flashes. But even in the breast cancer patients, that seems to be safe according to all of the studies. Hi, Katie. Is the estrogen in soy safe? Okay, that's the same question. Sorry for that. So I try to answer that question. So once again, when it comes to soy, there's a lot of ways that you can take it. I actually wrote a whole book on soy a number of years ago. It's called The Soy Solution for Menopause. It was a number of years ago. But in that book, I talk about soy because you can eat soy in a lot of different ways. I like it, you can get soy milk, which is very good, and you can use soy milk anywhere. You can use regular milk, like you can put it in pancakes if you make pancakes instead of water or regular milk. You can use it on your cereal and so forth. You can get edamame. I like the edamame. You may have seen them in the stores or in restaurants. They're like green beans. Those are the actual full soybeans, and they come in a green pod, and you kind of put a little pinch of salt on them, and then you can just eat those when steamed or boiled or microwaved. There's a lot of ways to make them. You can get the tofu. I like stir-fried tofu. I get it, cut it up, and put it in with vegetables and some peanuts and some seasonings. It's a very good meal. It's great protein and so forth. There's a lot of ways to get soy into your experience. Hi, Denise. I wake up constantly, and then in the morning I have a terrible time getting up. I dread my day. Yeah, that's awful, and it feels awful. And the reason that you feel so tired and worn out is because you're not sleeping well. Now, one of the things that happens in menopause, if you're doing a lot of snoring, if your partner is saying you're snoring like crazy, is sleep apnea, and that can be looked into, and keep an eye out for that. What about bioidentical hormones? That is such an important question. Bioidentical, I want to explain this. Bioidentical hormones means that the chemistry of it is exactly the same as the estrogen that's in your body makes. But just because it's bioidentical, it doesn't have to be compounded. A lot of people think if you go to a compound pharmacy that is, that's the bioidentical. But actually, in every drugstore in America, you can get bioidentical hormones at almost any dose that are FDA regulated. The compounding pharmacies are not FDA regulated, so there's some risk. And a very important study was done about 4 years ago. And in it, they went and gave a same prescription to 12 compounding pharmacies, and then had the prescription filled and mailed to a chemical plant where they analyzed what was in it. And it turns out that most of these prescriptions ended up having between 80 and 200% more estrogen than was ordered. They filled it correctly, but and then they had between 60 and 80% less progesterone. So women were taking this estrogen, this bioidentical compounded estrogen, and getting way more estrogen and too little progesterone. And so there started to be reports of uterine cancer in the compounded estrogens, but not from the drugstores, the regular traditional chain store drugstores. So be mindful that if you're going to use the bioidentical ones, quote, the ones that are from the compounding pharmacy, and you have a uterus, you've got to have that uterus checked, your uterus checked, to make sure the tissue isn't building up abnormally and setting you up for a uterine cancer. Let's see. Lola, hello Lola. Says, I met you in a Facebook. Right now, I'm hearing about menopause. I'm in menopause since 2002 after my cancer. I need help. No doctor will help me. I've been suffering a lot, and I have been having a lot of high fever. I don't know why. Weight goes up and down. I need your opinion when I could do or what I can do. Boy, Lola, that's rough. Of course, that's more than I can address here because I don't know enough information about you. But you really do need to talk with your doctor about it. hot flashes are annoying as the dickens, but they're not the only thing that causes night sweats and heat and fever, or feeling like fever and so forth. So you have to have that evaluated as an independent symptom and make sure what's going on with you. And, weight up and down is another thing that happens at the time of menopause. Though I know you won't believe me, but menopause doesn't cause weight gain. It causes weight distribution changes. It moves it from our other parts of our body to the belly. So you get that jelly belly and that pants that are too tight and a closet full of clothes that won't quite work and pants that won't zip. That shift in weight and fat is caused by menopause, and particularly by low estrogen. But it's not something that I can tell you exactly what to do in this setting. I do coaching on a select number of people if it's a right fit. I have a limited number of places slots that I can see people. And if you're interested to see if it's a fit, we can talk about it further. You can go, there's a form you can fill out at menopausecoaching.com, menopausecoaching.com, and I can look and see, and then we can, if it makes sense, we can set up a time to talk briefly and see if it's a good fit for what you need. But I can't really, I wish I could, but there's so many parts to it. It takes a lot of digging around to find out the details, because you have to be very specific. One size doesn't fit all. Each of you is very unique. Your symptoms are very unique, and to try and generalize, we can talk in general, but when you have a specific issue, it has to be individualized. Menopause is ugly. I know what you mean. I have been taking care of women for so long. I've taken care of over 10,000 women transitioning through menopause. There's a lot of menopause. So I've heard a lot of really challenging situations for this. Kim, how are you? Menopause is bad. When will it go away? We talked earlier about that. Very bloated. So, a lot of it has to do too with the food that you eat. That's up in the nutrition point. And the fatness and so forth. Some of it does. The bloating can be due to food choices. And a lot of times just controlling the nutrition, eating really whole foods, staying away from the trans fat, staying away from the processed food, trying to stay away from the lots of sugars, which are really the body doesn't like. What happens is, as a result of all the changes that you go through, the intestinal bacteria change proportions and cause some of the bloating and some of the discomfort that people feel. And as a matter of fact, in your intestines, it's hard to imagine, but in your intestinal tract, you've got 3 pounds of bacteria. Now, when you think that each one of them is less than the size of a pinhead, I mean, that is a lot. 3 pounds is a lot of bacteria. And estrogen also affects the way that they metabolize the foods and the medicines and all the other stuff that you eat. So it's a lot going on at this time. Kim says it's ugly. So anyway, if there's some other pressing things, I will try to address them, but check out the menopause quiz. Go to menopausequiz.com and take that quiz and get some information for how much menopause is affecting you. And remember that the important thing is that if you're going to treat yourself after menopause with alternatives to estrogen, you have to take care of the sum of you, not just some of you. Keep in mind that there are non-estrogen prescriptions. There are mental health, cognitive, behavioral things that can help you. There are lifestyle changes, including lowering stress, exercise, nutrition, and sleep. And finally, there are supplements that are available over the counter and other products over the counter. And if you do those things, they're going to help you. Please like the page so that you'll be informed when I do other Facebook Lives. And I hope this has been helpful to you. And I'm very happy that you are joining me. We're going to be back next week. And if you've got particular topics that are important to you, well, let me know. Because like last week, someone wanted to do alternatives to estrogen. So we're doing alternatives to estrogen. So if you've got something you'd like to hear more about, talk about, explore together, let me know. And I'm happy to help. So until next time, remember it's better to stay well than to get well. Please like the page, and I look forward to talking to you next time on Facebook Live, Ask Dr. Mache. And you can put your questions in ahead of time at AskDrMache.com. That's AskDrMache.com. Take care.